Hello, everyone. It's July 29th, Wednesday. Very sadly, I have to report to you we have had 5 additional deaths since Monday. A total now of 111 West Virginians, great West Virginians, we've lost. We lost our 107th death was an 87-year-old female from Wood County. We lost a 47-year-old female from Berkeley County. We lost a 79-year-old female from Mercer County, an 87-year-old female from Mercer County, and a 60-year-old female from Princeton County. It's just not good. That's just all there is to it. I think I saw this morning that, and I don't want to even quote this, but where Florida lost way more people in a day than we have lost, period, or in total. I just want to go back and tell you just this: as great as you've been, and as phenomenal as West Virginians are in this state, we still have real risk. And I want to talk to you just a second about at the Princeton nursing home. When we first were notified, we ran everybody straight to the fire. We tested everybody there. Now we're going back through and retesting because we now have had 2 people that quickly die. That quickly. Now, what we have got to realize that this thing is a killer. It especially attacks our older people. But we've had a 47-year-old die today, too, and a 60-year-old. Absolutely, we have got to do all we possibly can, each and every one of us. We can't drop our guard. We've got to stay on top of this. I was talking to a fella that we employ in South Carolina. And I was talking to him yesterday, and I said to him, I said, Tim, things in South Carolina seem like on the television, at least they're bad, aren't they? And he said, well, let me just tell you this story. Now, I don't know this because I'm not a medical doctor. I'm not a nurse. I'm not a person from the medical field. But he was talking of his wife that is a nurse at the hospital. I think she's an emergency room nurse. And she told her husband that, on x-rays where the lungs were, for all practical purposes, clear, in one day, the lungs are just covered with this, and that's how fast it can move. So please, West Virginia, use your best judgment and be careful and wear your mask and do all you can to suppress this terrible situation. The other thing I've told you over and over is we're trying to watch the migration of it from the south. And every day we see more and more and more of a migration. Now, part of that is just simply because we're traveling, we're going out of state, we're coming back, and there's exposure all over the place. Today, where we had 20, I think, people that were tested positive, today at that nursing home we have 23 staff and 19 residents. We have a total of 42 now. 2 dead. This thing really moves, and it moves very quickly. Don't end up being a casualty, West Virginia, please. We have 146 new cases today. Our active cases are now 1,647 in West Virginia. It's down a little bit since Monday. And Monday we were at 1,703. Our daily rate is at 3.95. That's terrible. Not terrible from the standpoint of a national scene, but terrible from the standpoint of what we want it to be in West Virginia. Our cumulative rate now is at 2.31. It just continues to slowly inch up. That's not good either. Now, we have outbreaks now in churches in 6 counties, down from 2 counties. They are Mason, Boone, Grant, Logan, Kanawha, and Taylor counties. We have a total combined cases that have slightly diminished. And all I can say is what I just keep saying over and over and over. And that is just, please take care of yourself. Protect yourself. If you wear a mask and you protect yourself, you are making such a contribution, it's unbelievable. But absolutely be great, loving neighbors that you are in West Virginia and take care of one another. Know that this disease attacks the elderly, and it absolutely is deadly to the elderly. But it also attacks us all. Now, I'm going to shift gears here because I have to. I've got to go on with the other parts of this that are, our business and our livelihoods. We are now pumping the money out the doors in regard to our small business applications. Money started going out today. We're pushing it just as fast and as hard as we possibly can. Just continue to register as a vendor with the state before you apply, and all the guidelines are up there for you, and we're just going to keep pumping and pumping and pumping money out as fast as we possibly can. I think our people are doing a pretty good job there. I want to give you an update on the Gary situation, and this takes into consideration all the county reps, all the good work that they've done, all the emergency services people and everything, all the good work that's been going on, especially from how fast our National Guard responded and ran to that fire. But as of this morning, the city of Gary's water system, not just delivering water, has been fixed and water has been restored to Gary. However, the city is still under a boil water, advisory for 7 days. Residents can obtain drinking water at the Gary City Hall or the Rock Hill Baptist Church in Gary. And again, I want to thank the National Guard over and over for how they ran to the fire, and the West Virginia Emergency Services, or the Emergency Management Division. Great work, people. And let's just keep it up, and we'll just, I've dispatched, like I said, engineers and additional staff members from the West Virginia Water Development Authority and the Public Service Commission of West Virginia to meet with the city of Gary and the mayor and all the other people that are in charge down there, and come up with a long-term solution to this problem, not just come up with a fix, that where we deliver a little bit of water and we don't do any more than just that. Because we want solutions, absolute long-term solutions. Our free testing is going on this week in Gilmer and Marion counties. Next week we'll be in Hampshire County. Take advantage of that. We have now tested 271,811 West Virginians. Now, that's a massive amount of testing that we've already done. It's way over 10% of our total population. It is a number we should be proud of, but the more we test, the more we learn. Absolutely, especially our minorities, take advantage of this free testing and get tested. If you have any apprehension, you have any symptoms, forget it. If you don't have symptoms, don't worry about it, and you're worried, go get tested. It'll help us all. From our grants to our cities and our counties, we're approaching $60 million and have now gone out to 160 cities and counties as far as the awards that have gone out, and we're continuing to just move this as quickly as we possibly can. I think, I think you'll see, and we'll make more of an announcement on Friday about it and everything from the standpoint of how we stack up in our performance versus other states. I think you'll be really pleased with that. Our summer feeding program is 696 sites. It's up on our website right now. If you're struggling with trying to figure a way to get food and maybe you can't get to one of these sites or whatever like that, just let us know. Pick up the phone and call 211. We don't want any West Virginian going hungry in any way. Just pick up the phone and call, and we'll come running as best we possibly can. Only other thing I've got is the census, and I remind you over and over and over, you're going to really let me down, West Virginia, if you don't, have some community leaders or street leaders or whatever that absolutely, are just calling their neighbors and making sure that everyone is counted, because West Virginia, this is fed money and it's free money and it's coming to West Virginia, and if we aren't counted, we won't get the money. So it's not like somebody's trying to identify where you are and the boogeyman's out there or whatever. Please just get counted, West Virginia. Always go to these charts, if they'll throw them up there real quick. You're going to see that top line. It looks like it's a teeny bit better and everything, but we've still got a long ways to go to see where we were when it was really widening out there, and that's what we want. Our daily positive number, you see it's popped back up, and we're trending above that dotted line. We don't want to be above that dotted line. Now, and if you'll go down to our cumulative, which means all of it put together, all of it averaged together. You see that, the way that thing's moving? That's not what you want at all. We're still phenomenally good. 2.31 compared to all of our neighbors and the states all over this wonderful country and everything. People would be so envious at 2.31, it would be unbelievable. But West Virginia, you see, it's trending the wrong way. And we just need to stay concerned, stay on our game, keep doing the good stuff, and we'll get this thing turned back down. Anyway, I just want to double check real quick. I did want to say this, that as of this morning, we had 254 active cases in Kanawha County, and they're the highest in the state, but they have dropped down from 266 on Monday. That's a good sign. And the Mon County cases, have dropped to 177. I think they were right at that on Monday. And now we have 94 people in the state that are hospitalized. That's up from 82. It doesn't sound like much, but that's a bump of about 12-13%. And we still got tons and tons of capacity. We're still in good shape there, but before you know it, you keep adding up these numbers and everything. We just want to turn this around and go the right way. Wear your mask, West Virginia. You got to do that. Okay, thank you. That's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and I think the governor is being very wise as he encourages all of us to continue to not let down our guard. The mask order and the folks that have really embraced this, along with maintaining our physical distancing and hand hygiene, hand washing, has started to make a big difference in the state. Our RT number is coming down. We're not quite below 1 yet, but we are approaching that. So that is good news, and well done, West Virginia. The comments that I want to make today is related to I think a good amount of research that's starting to come out on what happens to people who don't die from COVID, but who survive COVID. And there's a really concerning study, I think, that just is coming out in one of our really high-end medical journals, the Journal of the American Medical Association, JAMA, which is in its area of heart disease and heart health. And that study came from Germany. And they took 100 people that were in a study in Germany, people that have had COVID. About 2/3 of those people never needed to go to the hospital, got better at home, and about 1/3 were in the hospital. The average age for this group was about 47 years old, and about 53% of the people that were engaged in the study were men. And what they did is they looked after the recovery of people from COVID. They did very sophisticated studies looking at heart function using magnetic resonance imaging. And what they found was on an average of 71 days after people had been first diagnosed with COVID, that about 78% of people still had evidence of heart involvement, and about 63% of people had evidence of active inflammation, what's called myocarditis in their heart. And they did biopsies of these people and found inflammatory cells in the heart. And this really suggests not that everybody who's had COVID is going to have heart problems, but it suggests that there are lingering longer-term effects of COVID. We talked the other day about an outpatient study where about 34% of people didn't feel that they were back to their normal health, and about 20% of people that were aged 18 to 34 didn't feel well enough to go back to work. So I think that the governor's guidance for us is so important, not only to save lives, because we know that that's a priority, but also we want to perpetuate the health and the well-being of all of our citizens. And what we're learning about COVID-19 is that not only is this a killer, is an infection that infects others when people are asymptomatic or pre-symptomatic, and we've seen that go all over the world. But we're starting to learn that it may not be just no problem for the people that get better with COVID. There may be lingering effects of COVID that could include heart effects, at least in some people. So even more reason for us to be very diligent and make sure that we are protecting ourselves and each other, because COVID is a pandemic infection that can infect all of our body, all of our organs. And that long-term effect of the virus is something that we haven't spent as much time focused on or learning about, but more and more we're getting insights into that. So West Virginia, continue to do the great job that you're doing. And I think as we continue to wear our mask and do the appropriate steps, we can protect ourselves from getting the infection and the side effects from the infection, and certainly save lives and improve others' lives long term. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR.
Good afternoon, everyone. Let me talk just a minute about outbreak settings. The governor talked about this disease migrating from the south. There's a lot of truth to that. The evidence is, as we have completed contact tracing and looked at the source of the outbreak in the Princeton nursing home, again coming from Myrtle Beach. So that's a concern. As everyone will recall, this disease started in West Virginia essentially very slowly in a couple of settings, and then our focus on nursing homes was really to make sure we didn't have broad spread there, and the governor tackled that head on, and we really tamped that down. We then had church outbreaks that continued, and then we had a lull where I think people were wearing masks and paying attention. I just want to make sure that folks understand now that where we are is a broad range of settings and communities. We have outbreaks now in psychiatric hospitals, correctional facilities, daycares, child residential facilities, universities, schools, group homes, We've had community pool parties where we've had outbreaks, golf clubs, weddings, funerals, and we've gone back to the issue of outbreaks in nursing homes being a concern, as well as churches as a huge concern. So the governor is right on target in terms of our weapon, our defense in fighting this epidemic, this pandemic, is to wear masks. So please be considerate. Make sure you protect yourself and your families and protect others by wearing a mask. So thank you very much.
Thank you, Secretary. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Highlight several activities going on, as the governor pointed out. Continue to support the Princeton nursing home facility. We also are providing support to DHHR offices, as well as helping the West Virginia State Bar conduct bar exams, preparing for the testing lanes that the governor outlined for later in this week. Another exceptionally important mission going on is support to the Charleston Fire Department in sanitization of several facilities. In our lines of effort, one of the Guard's missions is to support our healthcare workers and our first responders to make sure that they can stay safe and operational. In addition, we have subject matter experts supporting the State Board of Education and our county school boards, as well as Higher Education Policy Commission on reopening plans in conjunction with our partners at the Bureau of Public Health. And most importantly, over the next several days, we'll be shaping the National Guard missions over the next several months based on the lines of efforts that we've established with the governor early on in the pandemic. Thank you.
Thank you, General. Dr. Ayn Amjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, we've seen some counties come out with their individual school plans for going back, and not everybody has submitted them, but we've seen Jackson County and Lincoln County. What's your thought about starting school? I know you've said September 8th is the date, but is it set in stone that every county in West Virginia would start on the exact same day? Or is there a possibility that you could look on a county by county basis to see if there's a problem somewhere, or if you've got more difficulties somewhere, that you would be able to adjust that starting date for that particular county? I don't know if there's laws that stand in the way of that, or if there'd be other complications, but how flexible are you willing to be once you get to the actual start date to maybe hold some counties up if they're not quite as ready as other counties throughout the state? Thank you.
Kenny, all of us need to realize just the exact same thing that I have preached until I'm, in my words, blue-green. This situation is ever changing, and there is nothing that's etched in stone. Absolutely, our local counties will surely know the best for what's going on within that county, and we will work diligently with them in order to make it work as best we possibly can for that county. The local control is always better. Now, at the same time, I'm seeing all kinds of different plans come out. Our state education department is working on every kind of, all different ways that we can have in classroom, learning. We can have virtual learning. We can have all kinds of different scheduling and all that kind of stuff. Absolutely, we pegged September the 8th as a date that absolutely I think our schools cannot start before then. And the reason for that is just this: buy us time and see where this thing is going and everything. As we get closer, we're going to have to pivot and adjust and do a lot of different things. I commend, President Gee and President Gilbert and all those at our colleges and everything that are working on constant plans. We meet and we think that we can move in this direction or that or another direction. But at the end of the day, what we have got to be able to do, we've got to be able to lay our head down and know that there's real risk, but know that we are mitigating that risk as best we possibly can. Now, absolutely, I still do believe with all in me that we're going to be able to go back to school. I believe we're going to first and foremost protect our kids and our teachers and our service personnel beyond belief. Can we guarantee 1,000%? No, you can't do that. You know, there was a question posed, I think, by Hoppy the other day and said to President Gee, said, well, Mr. President, you know, you've got all these sophomores and juniors and seniors or whatever, you know, that are going to be coming back to the apartments that they have obligations, you know, and they'll be back on, not on campus per se, but back in that situation. Could this situation get worse? And I noticed the pause in President Gee, and he said, Hoppy, I don't have a crystal ball. We think that this is the very best that we can possibly do. We absolutely believe this is the best course of action to provide us with the most safety, and yet the best we can possibly do. All of us have got to realize just that. You're dealing with a pandemic, West Virginia. West Virginia, you are dealing with a pandemic, the likes that none of us have ever been involved with. We have got to bridge ourselves. We have got to bridge ourselves to a vaccine. That's all there is to it. We've got to deal with it. I mean, how bad could it possibly be to sit up here and read death after death after death? How bad could it be to not have any idea that you've got an issue or a problem in the Princeton nursing home, and then boom, you got to move, and you got to move right now. And we do. And we suppress it as best we can. It'd be nice to sit up here and just brag about how great our numbers are. They are great. They're great. But now there's 111 West Virginians that are absolutely missed so much, they're dead. And there's a whole lot others that are sick, and before we know it, there's going to be more. Our counties, I have very solid confidence in Clayton Birch and all the education people and all of our counties, our superintendents. I have absolute confidence that they're going to put on the table really good stuff, and they're going to be different. They're absolutely going to be different. They have to be. I think Doddridge County, I don't know if Doddridge County now has a case or not. I mean, they were the last one too. I mean, you know, if they do, there's 2 or 3 in the whole county. Well, we can surely do stuff in Doddridge County that maybe we have to do differently in Amon County or Kanawha County. Our superintendents are going to have the ball, and they're going to do good stuff, and they're going to protect us in every way. In some way, somehow, you know, we are working on other plans to be able to help our students, and I'll be rolling that out in the next day or two too.
All right, thank you, Kenny. Next, we'll go to Lacey Pearson with the Charleston Gazette-Mail.
Thanks, Governor. This is Lacey Pearson with the Gazette-Mail. This morning in a conference call with media, Senator Joe Manchin expressed some of his concerns about West Virginia's use of CARES Act funding. He particularly mentioned that 45% of the money that the state received should have been dispersed to counties and municipalities, but only like a tiny fraction of it has. He specifically said that your office is holding on to the money. And in his words, he said that your office was using it as a political slush fund. So I have 3 questions. Why haven't counties and municipalities received more money? How can they access that money? And what's your response to the senator's comments about it being a political slush fund?
Well, guys, you know me. I can't do anything but tell you the truth. It's a lie. It's a lie. What Senator Manchin ought to do is concentrate on the job that he has in D.C. and get that job done and get that job done properly. He ought not concentrate so much on trying to run Ben Salango's campaign. Can you not see right through this? We have people all over the place that are absolutely following every guideline known to man, and we're pumping out money like you can't imagine. And just him just grandstanding and running Salango's campaign and coming up with all this stuff, he does, you know, absolutely, you know, from the standpoint of saying, you know, that I'm sitting on money and doing this and everything, it's just a flat lie. That's just plain all there is to it. There's no other way to say it. You know, it's grandstanding while running Ben Salango's campaign, and it is exactly what Joe Manchin has been since day one, a politician. You don't have a politician sitting here. You don't have a politician sitting here at all. You have somebody that's trying to protect all of our West Virginians and absolutely do it from an economic standpoint and a health standpoint, and that's what you got.
All right, thank you. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. During recent briefings, we've heard that the lag for receiving test results may be as long as 7 days. I'd like more clarification on if that is an estimate or what is the West Virginia average once someone is tested to receive results back. In line with that, I've heard many times we're going to run to the fire if there's a problem, whether it be in a nursing home or when schools open, maybe we're worried about community spread surrounding a school. But are we flying blind if there's a 7-day lag in receiving test results? Thank you.
Well, let me before we go to the health community, let me just say just this. Running to the fire is what we've done from the standpoint of when we closed the schools. When we were the first in the nation to test the nursing homes, when we were the first in the nation to go out and say, you know, here's what we're going to do as far as assisted living. You know, it is over and over and over where West Virginia has run to the fire. And West Virginia absolutely is not me. I mean, for crying out loud, West Virginia is you, West Virginia. You have run to the fire. And you've done it and done it and done it and done it. Now, from the standpoint of testing, it's a national problem. We all know it's a national problem. And in West Virginia, you know, right now, we initiated this 2 months ago. You know, we initiated where we took dollars to try to get additional testing capabilities up and going. All kinds of PPE and all kinds of additional testing up and going. Now, I'm going to defer now to our medical team, and they can tell you more about that lag. I don't like the fact that the lag is 1 day. And I know that in situations the lag is 7 days and even greater in some spots. For the most part, it's not, but in some it is. Now, if Dr. Amjad or Dr. Marsh will take over there, please do.
And you want to start, and I'll add in afterwards.
Okay. Well, Brad, you said a couple of things there, and the time lag is across the country, and that is because of all the samples that every lab is getting. And unfortunately, that is something we have to deal with. Right now in West Virginia, we are dealing with several labs across the state, and we are right now at DHHR trying to get more lab contracts to see if we can fix that problem and trying to get one in the state itself so that we don't have such a lag time. Unfortunately, that is not something we can speed up the process with, but we are trying to work very quickly to deal with that. But it does cause some issues, especially with people having to quarantine and to wait for those results, but we are trying to address that as quickly as possible. But I'll let Clay answer some of those other questions that you had.
Yeah, thank you, Ein, and thanks, Brad. You know, I think that the truth is that we have several different resources for testing. We do have rapid testing, and that testing can be used at point of contact and can give us a result very quickly if we need to. We do have in-state testing at some of the medical facilities and a private lab, Q Labs in Charleston, and those returns can be faster. But as you suggested and what Dr. Amjad suggested as well, that many of these big national companies that are doing testing, Quest Diagnostics, LabCorp, because of the incredible demand, have seen their results pushed out 7 to even 14 days. And so that is very difficult to be able to utilize in those settings of acute need to understand what's going on. But I think it's important to know that we do have several different resources that can get us results quickly, but these resources have limitations. So therefore, doing global testing, it's hard to pull from only the sort of the most rapidly responsive resources we have.
This is Bill Crouch. If I could just add one thing. Our local lab, our West Virginia lab that we rely on a lot, did have backups, Brad, and we're running 8 days a week or so ago. They've pledged to get that timeline down, and they're now running 4 to 5 days. We had communication with LabCorp, one of the large commercial labs we utilize. They have indicated that they're down to 2 to 3 days. We have not seen that yet, but that's information we got directly from them this morning. So we're hoping those numbers those timelines are dropping for getting results back. It's very difficult to test nursing homes, for example, once a week if you can't get the test back by the time you need to do a second round of testing. So we have great concerns about that. We're pushing very hard to get those timelines down.
All right, thank you, Brett.
Brad, it's a great question from the standpoint that it is a concern of all of us. I think really and truly, if from the standpoint of fairness for what everyone is doing, everyone here recognizes the fact that as time goes, with the stress on the system that has happened from our southern states, now we have a total outbreak of stress on the system in the southern states. You can see from listening to the experts and everything how much effort has gone in to try to make that effort speed up as much as possible. We're working that nonstop. We're very, very hopeful to have WVU up toward the end of the month of August, that we'll have much, much more capacity. And at the end of the day, this is no different in many ways than the initial outbreak and people struggling about PPE. Our Guard has done phenomenal work in regard to that, so we're in solid shape there and everything. But this situation, we're keeping it under control, but it's right at a threshold to where we want to push it back down. Instead of it being, let's just say that the average wait time is 4 or 5 days now. The average, that to me is right at the threshold that we want to push it back down. We don't want that to all of a sudden to awaken to an average threshold of 8 or 9 days, and then we're chasing the car rather than driving the car. So I think our people are doing a good job and everything. We're staying ahead of it.
All right, thank you, Brad. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Yesterday, officials with the National AFT, the American Federation of Teachers, said that they would support strikes among educators who don't feel safe going back into the classroom. Is this something that is impacting our opening plans? Is this a concern for Superintendent Birch and those trying to figure out how to safely re-enter? Thank you.
Charles, I hope to goodness that we don't get to that, but at the same time, we want to absolutely make this so safe for our teachers and service personnel and everything, and that's why we're working on these plans nonstop. Our Superintendent Birch is doing a fabulous job, as well as all of our other superintendents. They're on it. They're watching the numbers. They're doing everything they possibly can. And at the end of the day, I surely to goodness hope we don't get in a situation like that. But I understand concern. And that's why we're trying to do everything we possibly can to surely not end up in a situation like Florida where we're chasing our tail. And so let's just stay ahead of it. I think, all that discussion is way too premature to be talking about right now. But I understand concern. I mean, for crying out loud, some of our teachers are older, and absolutely, I understand the concern, and we want to, move that concern to where we can, rest it as best we possibly can.
All right, thank you, Charles. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams for Ogden Newspapers, and this is really a question for Dr. Marsh or anybody on the medical panel. But I know there's some literature out there talking about the ability to lower the amount of time that people that are infected with COVID-19 be isolated, quarantined. I know I think the standard time has been about 14 days due to the incubation, but I had seen where that has been possibly being lowered to around 10 days versus 14 days. And I just didn't know if anybody wanted to kind of comment on that, or if that is something you all are paying attention to. Thank you.
Dr. Marsh, you want to comment on that, or?
Sure, I'm happy to take that, and certainly Dr. Amjad might want to add in as well. But the CDC has changed some of their guidelines, and so as we look at people that are defined with COVID, then those people should be quarantined for at least 10 days after their initial diagnosis, and that should include 72 hours of being symptom-free completely with no use of Tylenol or Advil or Motrin or anything like that. What's different, though, is that people that are exposed in close contact, the case investigation that might disclose, if you've been in close contact with somebody who's been diagnosed with COVID-19, even if your test is negative, then you should be in quarantine for 14 days. And those will be people that are identified by the contact tracing and would be notified by local health departments. So it's a confusing thing, but if you've been defined with COVID, then it's 10 days minimum, and that window suffices. If you have not been diagnosed with COVID, if your test negative, but if you've had close contact where the concern is that you may still have contracted it, then you are asked to quarantine for 14 days. That's my understanding. Dr. Amjad, I don't know if you have anything to add, or correct me if I'm misquoting the CDC.
No, that's correct, and that's why a lot of people get confused. But the CDC does state the 10-day window now. But if you've been around someone with COVID-19, we still recommend the 14 days because of that window period. But we always refer people back to the CDC guidelines or a DHHR website because we do keep those up to date because of those things that are ever changing, to answer your question, because there's a confusion. But anyone who's been exposed to someone with COVID-19, we still extend that to 14 days to be on the safe side, but to refer back to those websites to read them carefully. And if you have a question, to call your local health department. But they do change a lot, and people do get confused. But you need to go to the websites or call your local health department.
All right, thank you, Steve. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. My question is about the closure of bars specifically. Just looking at the numbers, it appears that Kanawha County has more active cases than Mon County. I'm just curious if you plan to extend closures to other places that are also having outbreaks, even more, I guess, significant than here in Mon County.
This is David, is that correct? David, let me tell you this, from the standpoint of closing the bars and making the mask mandatory and everything, we can see it worked in Mon County. But in Mon County, you've got kids, kids piling into bars in a different atmosphere than you have in Kanawha County. In Kanawha County, the first thing we did is we had extensive conversations with the health experts in Kanawha County. And they told us just this, that they do not feel like in Kanawha County that there is a situation to where we have a COVID outbreak from the standpoint of the bars. They told us that their situation was much, much, much different. And so absolutely, that's the way we have to treat this. They said theirs is more of a community spread than it is just the bars. And so from the standpoint, the bars are much, much different. You know, I think there's really only three cases that have been reported that have been bar related so far in Kanawha County. So it's different. It's just different. And you know, that's why there's so much information here that a lot of people don't have. And I'm sure that's why you ask your questions and everything else like that. But let me just end with this on this one. You know what I'm really the most worried about right now? I'm really the most worried about the counties that are on our southern or western side, because those counties we're seeing the migration of this situation, whether it be from Kentucky, you know, whether it be from the south. We're seeing a migration into our southern counties. I think the last couple of days we've had 13 positive cases in Logan County 2 days in a row. Now just think about that. What if you multiplied 13 positive cases by 55 counties? You would end up well over 600 total positives in this state. And we haven't had a day anything to approach anything like that. So basically what we're saying to a county that surely doesn't have a significantly high population, they have a lot of positives going on right now. Now, from that standpoint, you know, that's really what I'm probably the most concerned about now, is how this thing is moving, and really and truly, from the standpoint of the bar situation, we had kids piled on top of one another. We had a lot of situation up in Mon County, had to moved. I think that was the right thing to do. The numbers surely reflect that and everything. In Kanawha County, different thing. We have been in touch with the health people through and through. But my concern primarily right now is what's going on in the South. What's not necessarily just Southern West Virginia. What's going on in the South that's making this thing move, and just, you know, just think about it. 2 dead in the Mercer County, in a nursing home in Mercer County. A whole lot of people infected. It'll be a miracle from God above if more of them don't die. You know, it's just terrible. It's just absolutely terrible. Where'd it come from? Myrtle Beach. You know, it's just, that's my big concern.
All right, thank you, Dave. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet. Governor, I'm wondering, I don't need exact numbers, but I'm trying to get an approximate gauge on how many businesses have already applied for those small business grants, how much money is going out before the end of the week, and any particular trends. Are we seeing a lot of restaurants applying? I'm hearing from a lot of restaurant owners that are literally on the brink of going under and closing their doors for good.
Mark, we've had well over 2,000 apply, you know, or right about the total number of the 2,000 that are being processed right now, or have been processed. From the standpoint of the restaurant owners, I am terribly concerned about them, because, you know, they've had a tough go for a long time here. A lot of businesses we reopened and they were at 50% capacity, and, you know, and they're just hanging on and everything. You know, I think Kentucky, you know, dropped to 25% capacity just, you know, last couple of days. Kentucky said, we're not going to do mandatory masking. Well, the last couple of days, well, we're going to mandatory masking. You know, Kentucky said, you know, we're you know, our bar situation, our restaurants, fine. They closed all the bars all across the state, went to 25% capacity, and, you know, in the restaurants and everything. I am telling you that I am absolutely super concerned about our restaurants, and we're trying to do everything in us to help. In addition to that, if our Senate and House would absolutely lay aside this hatred for Donald Trump and all this politic gobbledygook, if they'd lay that aside There are people that are out here that are hurting, that are running out of unemployment benefits. There's businesses like the restaurants and everything else that are out here hurting. And that's why I say, let our senators and legislators go do their job. I mean, for crying out loud, you've got people that are hurting everywhere. The restaurants could very well qualify for another round of the PPP payment, which would help probably save them. You know, you've got all kinds of things that that the train is waiting on DC. And so, you know, from the standpoint of you see it, all you got to do is turn the television on and watch the fighting and all the stuff that's going on. You know, we're absolutely sitting here, you know, and just watch. You know, I mean, think of the audacity of Senator Manchin to criticize how we're sending out these CARES dollars for our cities and counties. I mean, for crying out loud, are you kidding me? We're absolutely pushing the envelope beyond possible belief. Joe needs to absolutely, to the tune of $60 million have gone out the door so far. Joe needs to go and watch his votes. It'll be lined up right with Pelosi and everything else, and absolutely, it is not what we need to be doing. We do not need to be fighting in D.C. We got people hurting. We got our restaurants that need our help and everything. Absolutely, I'm trying to help in every way I possibly can. That's why I put $150 million over in the small business thing. You know, what would we do? What would we have done if we just didn't put any money over there? You know, you've got people that are hurting all across this state that we're going to be helping, and so, or that we're already helping. So that's what we need to do. We need to, you know, stay the course. If they'll pass this fourth round of stimulus, it'll help our restaurants. I'm worried about our restaurants like crazy. I'm trying to help every way I possibly can, and that's what I'm going to continue to do.
All right, thank you, Mark. Next, we'll go to David Beard with the Dominion Post. David, I think you might be muted.
Oh, sorry about that. Thanks. My question will probably go to the medical folks. The hydroxychloroquine or chloroquine, however you say that, is back in the news, and a little bit of it's a bit unhinged, but there seems to be some legitimate literature that it can be a decent treatment in the right context, and I wonder if our medical people have some insight on that.
Okay, medical team, y'all take over.
All right, I'll start this one and then I'll hand it over for others. So David, thank you for the question. You know, this is a confusing area and a complex issue. As we look at the literature, there are, in my read, about 3 randomized studies, which means basically you look at giving people one treatment or another, or having some people that get hydroxychloroquine with or without another drug, azithromycin, which was used in a French study that ultimately was done by the National Institutes of Health and by the World Health Organization. Those studies using hydroxychloroquine to prevent disease in people that might have been exposed or to treat disease did not show a benefit of hydroxychloroquine, and in one study did not show a benefit of hydroxychloroquine plus azithromycin. There's a few retrospective studies looking at the experience that people have had at their own medical center, the most recent one from Henry Ford Hospital, which did show a benefit. So I think what this says is, in the best done studies, right now, hydroxychloroquine has not been able to show a benefit, but in other studies, there is some idea that maybe it does have a benefit if we could define it better. So I think that right now, for me, I would say that I would not take or give hydroxychloroquine for somebody who either had an exposure to COVID-19 or who was infected. We do have some other treatments that have been shown in these same sort of randomized studies, like dexamethasone, like remdesivir, like convalescent plasma, all have had some beneficial effect in these prospective randomized studies. But it also says with hydroxychloroquine that while today, I wouldn't take it or prescribe it for people, that I'm sure there'll be more work done. And like anything else, we're not trying to have a side of that we say, yeah, we love this and we don't love that. We are really just trying to reflect to the people of West Virginia and to the governor the results of the best done work, research that we can find, and try to communicate that. And as the governor said, this is a rapidly evolving area. And as we get more information, then that judgment could change. But right now, I think the best done studies have said that hydroxychloroquine alone or with azithromycin doesn't have a beneficial effect on patients with COVID-19 as a prevention or treatment mode.
All right, thank you, David. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, everyone. Yeah, it's Taylor with the Herald-Dispatch. My question is probably also for the health officials. At what point as hospitalizations continue to increase, at what point will we start to worry about that? And what would you say to someone who is maybe nervous about going to the hospital for any type of procedure that they might need as hospitalizations for COVID are increasing?
You want to take that?
Sure.
Okay.
Taylor, I would say that most of the hospitals right now have taken COVID precautions. They are cleaning their hospitals regularly. They've also limited their patients from having visitors. Most of them have limited their visitors. So they've taken all the precautions to have any increased people coming in and out. So most of them have taken that way into account even when COVID started. So they've taken any necessary steps. And if you're going into the hospital, of course, you have to wear a mask yourself. And they've had ways to prevent that. So you're safe to go in if you have necessary procedures to be done. And once the hospitals have reached their capacity, they send us that information. So you should be safe if you need to do that. And then you can also talk to your doctor for any other necessary things that need to be done. But we get information when hospitals are starting to reach their capacity and they've been able to divert patients to ones that can hold necessary things. But if not, we are able to get that information out there. But we know when hospitals start to reach capacity as well.
All right, thank you, Taylor. Next, we'll go to Paul Mullen with WCBC. Hey, Paul, we can't hear you. It looks like you might be muted on your end. All right, unfortunately, Paul, we just can't hear you today. So, Governor, I will turn it back to you.
Well, let me end by just saying this, that I said this a little while ago, and I say this as profoundly as I can possibly say anything. West Virginia, you're dealing with a pandemic. That's all there is to it. I mean, it is a national tragedy when you think we're right at 150,000 deaths, and the totals just keep adding up and adding up and adding up. It'll be a miracle beyond belief if we don't zoom past 200,000. 250,000 is 250,000 people. I just caution you in every way. I welcome input. I even welcome criticism. I welcome knowledge. I welcome all of that. The only thing I don't welcome is just this. It's no time for us in West Virginia to be a politician or be a Democrat or a Republican or an independent. There is no time. There is no time for us to be that right now in West Virginia. We are dealing with something to where we all need to be one and only one, West Virginians. West Virginians trying to get through a situation that is really tough, and we're doing it, and we're doing it in a way that is the very best that we possibly can do it. As we continue to solicit more and more knowledge from any and everyone that's out there and everything, and continue to be fluid and adjust and make sure that we're doing the dance and doing the dance the very best way that we possibly can. I stole the word "to dance" from Clay Marsh, but West Virginia, please just listen to me and end with just this. Please continue to wear your mask. Please stay right on your toes. It's so easy for us to drop our guard because we've never seen anything that even approaches anything like this. It's invisible too. It absolutely, we know it's here, but we can't touch it. Absolutely, West Virginia, please listen to me. We are absolutely the oldest, the sickest, the most vulnerable position of a state to where this could jump on us in a way that nobody could stop it. You're doing a good job. You should be very, very, very proud. But I know we can even do better. Try with all in you. Protect yourself. And let's lay aside the politics, and for crying out loud, let's get through this terrible pandemic from a standpoint of medically and economically, and I think we're going to be fine. But we still got a long ways to go. Thank you, West Virginia.